Before starting anything, we would like to have a blessings from our masters. So I seek blessings from our masters. We give tribute to our master Samuel Hahnemann, who have taught us dare to be wise. With the blessing of our Guru, we are here to give hope for the hopeless, and we are making dependence to the independence. So, Dr. Vijayakar sir has taught us homeopathy is mathematics and is certainty in science. My biggest inspiration, Dr. Jitesh sir, who introduced me into the field of homeopathy. Special thanks to the sirs. My mentor, guru and best friend forever, Dr. Suketu Shastri. Special thanks to him. But Dr. Vijayakar sir told that I do not see what mind does not know. So today's exercise of the case presentations approach to this kind of case, which will help you that what to be seen in the cases. If you know something about that, then and then you can understand. You have to reach to the core of the patient. If you don't know, in front of you the patient is telling you all the symptomatology, but you cannot understand that. So physicians are always tell, I do not see what mind does not know. So today's exercise is knowing into the things. So I am installing something in your mind, so you can retrieve from the patients. Okay. So here my chief aim is to create the right thought process about the homeopathy. So please understand me without any prejudice. So what was the today's agenda? The today's agenda of the case study basics in the camp I learned from my mentor Dr. Suketu Shastri. So first and foremost we have to understand diagnosis and the report of the patients. What patient is presenting to us. Is he a Down syndrome? Is he autism? Is he ASD? Is he ADHD? Is he mutism? Is he a cerebral palsy child? The different kind of cerebral palsy, spastic CP, okay, hypotonic CP. So you can understand diagnose and the reports. In the reports you can find out certain pathology like anemia of the brain, hypoxic ischemic injury of the brain. Or sometimes you can find leukomalacia, or you can sometimes find as cystic changes in the white matters. Okay, so on the basis of this, you can understand the case process. See, our exercise is to understand the miasm first. After that miasmatic process, we have to understand how to approach this kind of cases. So first point is that birth history, we will go detail each and everything, ability and disability. This has to be done in each and every cases of camp. Very important aspect. See, this aspect is very important. Once you understand ability and disability on the basis of developmental of the child. So most of the time we have to write child is not holding the neck. So development has not yet started. Okay, child is not engulfing the things. Swallowing is not proper. So development has not yet started. Okay. So this will guide us to understand the follow-up. If this ability is converted into ability, that means our medicine is in the right directions, and that will help us to guide that we will continue this treatment for the further improvements. Okay. So you have to write ability and disability. The fourth point is a timeline. The timeline is called as a JOD, journey of the disease. Very important, journey of the disease. A small fragment of the journey will help you that the sequelae of certain disorders will happen into the cases. So you have to ask, see, child born normally. Okay, up to 9 months he was absolutely fine. Suddenly he got a fever. After fever he got a convulsions. After convulsion he goes into neuroregressions. And child was diagnosed as autism. You know, small fragment of the history will help you. It is not by birth, it is after birth. So autism can be divided in two categories, before birth and after birth. So same way you have to understand this is child is having a culprit of before birth prenatal or natal insult, or the insult which is after the birth. Okay, so that is the journey of the disease to help you in the cases. Miasmatic progress of the disease, very important. The initial report shows that there is a hyperactive ischemic injury, followed by 3 years the MRI report shows there is a periventricular leukomalacia. After 3-4 years there is a cystic changes in the brain. The miasmatic progressions of the disorders. Okay. Very important aspect of the mutations, Down syndrome, CP and everything, where you have to find out the mother history during pregnancy. Why it is important, I will tell you in the details. After taking that, you have to find out either emotional causes or reactions of the mother. Emotional causes can be a emotional trauma, can be a perceptions and a reactions in terms of their process. Say for example, certain women who give up themselves. So we already take their resignations, discourage resignation. In that case, we find out a patient which is very shocked, paralyzed kind of resignation. If you find a spastic sleepy child, so where there is a contractions of the upper limb and lower limb, you cannot take resignation because the spastic sleepy is because of certain anger emotions or sometimes of fear emotions. Whereas in the hypotonic sleepy, the shock sleepy, in that you have to find out the shock or resignation. So this is the calculation what Vijaykar sir has told us in the history. So you have to match that mother history and the child process. The last important point is child disposition. In the child disposition, we have to understand the how child is developed, what was the child's basic innate characteristics, and in the innate characteristics we have to understand either he is extroverted or introverted, how was his will, intellect, moral. Even though Down syndrome children having a good intellect, they have a certain abilities like artistic abilities, playing abilities, extroverted kind of personality. So this is very important to be considered into the case. And finally, you will rule out on the basis of the symptom totality you get. So this is what the basic of case taking. Now we will go deep into each and everything. First and foremost is diagnosis and the report. So in diagnosis or report, understand about the body. What body tells us. See, what sir has always told is mind and body tell the same language. The meaning behind that is the body tells us certain symptomatology. So we have to reach to the core, emotional core of the patient, that what was the mental trauma lead to this body postures or development of the body. Okay, so you can find out is the correlation between the mind and body. So what sir has told, basic pathology is equal to mind-pathology to target. So we will discuss mind-pathology with certain example in the later slide. And the most important is aphorism number 3. What is to be cured in the case? If we know what is to be cured in the case, then and then we can apply to the patient. If we can't, then we cannot. So first slide was I do not see what mind does not know. Okay. The birth history. Very important. Just taking process of the birth history. You have to understand how the birth is. Is it a normal birth? Is it a soft forceps delivery? Or is it the LSCS? If you have a normal delivery, ask about what was the labor pain, what was the triangulation, the mother is a triangle or a mother is the secondary or a multiclavida. So in that case also, why forceps is used, why vacuum delivery is used. So what was the reason behind that you have to find out. Because the labor is prolonged, the mother is tired, the mother feels shock, mother feels anticipation. So this emotion can give rise to certain disorders. Or mother is shocked, mother has a fear, that also give rise to certain neurochemical changes in the mother's brain, leading to the changes in the child's anatomy or physiology. So most of the time we have this common history. You can find in the oligohydramnios or core around the neck. So what do you mean by oligohydramnios? Oligohydramnios is the amniotic fluid. Amniotic fluid helps us the child to give a nutrition. Okay, and the mother is become oligohydramnios. That means what? The mother survival is at certain process. That mother is not going to give a nutrition to the child. Ask about what was the survival of the mother in the later month of the pregnancy. And when you find the certain process, in that case you have to understand that this is the case in which The mother emotion trigger the pathology of the child. Are you getting me? Then we have to understand cord around the neck. What do I mean by the cord? Cord is giving a nutrition to the child. What is the neck? Neck means this process of strangulation. So the certain situations makes the mother that this child would not be born. I will strangle this child. This is an unconscious process behind that. But somehow child will survive. So you have to understand what was the trauma is suffering from the mother. So mother survival is most important in the development of the child. So you have to perceive the mother mind state from the pathology during the pregnancy. Are you getting me? So this is what we have to understand. Why mother is suffering from this? Why? What was the situation? There are two factors. We will go deep into the MSDP. Then we have to ask about that after delivery, CIAP, cried immediately after birth. If the child is not cried immediately after birth, that means the child is going into the state of hypoxia. When the child is state of the hypoxia, that means the child is going toward the death. Okay, so it will create a syphilitic pathology into the child, and that leading to the hypoplastic CP or hypoxic ischemic injury leading to the CP child and everything. So they become evolutions of the human being from the unicellular to multicellular, that means a human. So when this hypoxic injury happens, so human get retrograde into evolutionary process and they become animal. And that leading to, so most of time you can find out the animal remedy in that cases. Are you getting me? This is just a clue. I am just giving you a brief outline and the clue of the cases. So you can find each and every cases. See what Hahnemann has given in the aphorism that I am giving you a general guideline of the case taking. So here also I am giving you general guideline of the case taking specifically in the camp. And from that guideline you can use your logic and then you can find out what was the PQRS or morbid in the particular case or the mother history. And very important aspect is the first symptom to be developed the neonatal jaundice or incubator. Why? So this is very important. Most of time certain children goes into the physiological exaggerated jaundice and that physiological exaggerated jaundice goes into kernicterus. And after that kernicterus that lead to the brain damage. So we need a remedy that is primarily affected by the liver and that liver is going to damage the brain. So you have to ask what was the survival of the mother for the liver. So liver represents certain things. We will go into deep into the minor pathology. Prenatal or antenatal care. So very important aspect of the case taking is what was happening in prenatal. Prenatal means before birth. Antenatal means during pregnancy. Okay. So you have to understand this process. What was the situations. Okay. Then very important aspect of case taking is ability and disability. You have to make a two column, ability and disability. In that case you have to write the developmental milestone where the child was stuck. The child was stuck certain into the neck holding is not there. Sometimes the child neck holding is there but child cannot sit properly, child cannot walk properly, child cannot have a speech. So this is the developmental milestone where that child is stuck. And what was the ability child can do with this? Okay, so that is very important. And the disease process. So you have to write in ability and disability. Clear? The third point, the fourth point is timeline and journey of the disease. So this was just a brief idea that I will guide you. That if you find certain that you have to write in the fourth column like that here, diagnosis, treatment and conflict. Okay, so if we find that there is eczema in 1990, that means the treatment by the local application. This eczema represents there is something problem at the level of integrations, communications or a relationship. So you have to find out certain integration. Then there is a diabetes in 1990. This is for general cases, but you have to understand that you have to write in each and every case. Diabetes now on treatment. So diabetes is related to certain property money conflicts with the Punji, the powerhouse. Okay. 2007 there is a hypothyroid on treatment. So hypothyroid, that means there is a powerless for conflict, authority conflict there. You have to find out. So now we have to combine these 5 points and ask the questions. What was the relation issue? What was the money loss in your relationship? That will help you, that will goes on the that. So most of time certain patients say that I have given money to do business to my brother, and my brother has not given that money back to me. Okay, he is cheated on me. So integration was there and there is a cheating. So that sensitivity lead to these two process. Now we ask that, do you have done something for this? So he is my elder brother, so I cannot do anything about that. I am the younger one. So my authority also gone. Previously I am the authority because I have given money to that my brother, and that lead to the hypothyroidism. And now what? The patient developed, everything is my mistake. I had done the same thing. If I have not given that money to that, then this will not happen. So this is leading to self-devaluation and autoimmune process. So this is what the journey of the patient. So according to that, you have to ask the questioners, what was happening in your life. So this is what preparations. Okay. So same way in the mother, you have to ask a certain chronology, then ask about the, then find out the conflict. Conflict is related to the mind of pathology. We will guide you. Then miasmatic process. So we have to understand the miasmatic from the journey of the disease. So here eczema is a psora, psychosis, autoimmune. Clear? So progress. Then what was the happening in the follow-up? Reversal from this to this, this to this, this to this. This is what follow-up. So miasmatic progress will help you in the follow-up also, from syphilis to psychosis, psychosis to psora. Very important aspect is mother history during pregnancy. So mother history during pregnancy, it is something that the emotional causes can lead to mother to develop certain anomalies in the children, and it is the reactions of the child from the mother trauma. Are you getting me? The child is the reactors, the mother is the creators. Okay. So what was the things which can create these things? So there are the two factors, which is one is called as epigenetic factors, one is called as the genetic factors. Epigenetic factors is called as external factors. External factors means the environment during pregnancy. So there is a certain trauma or emotional turmoil happen in the mother's mind due to the environment, which can create a certain perceptions that this is not a good survival mechanism. You cannot survive in this area because this area is not good. Even I am not taken care of, who will take care of you? So not to survive, it is a better rule. So that is the perception created in the mother because of epigenetic factor. Are you getting me? And the genetic factor means the internal factors, which is based on the emotional trauma which mother has perceived previously, and the mother wanted that I don't want this child. Or sometime unwanted pregnancy was there. She was not wanting the child, and the in-laws and the parents want that you have to continue that, and in this the conflict is going on, and that conflict creates a certain havoc into the children. That is called antagonism with the cell. Okay. So this is the internal factor, it is a genetic factor which can lead to the emotional trauma, and that emotional trauma lead to the perception of the mother. So this perception has to be counted into considerations. Very important. And the last point is child disposition. So once you see when we were going to the camp in Mumbai. So at that camp, Dr. Ishan Gandhi always told that understand the child first. So he used to poke the child. He used to traumatize the child, and the child reactions. He used to find out the child reaction. So child reaction is based on his genetic perceptions. Okay, some sleepy child is very happy. They are very cheerful and always smiling in front of anyone. So this is something called as they are extroverted kind of person. So you have to understand that, and that is very important in the case study. So extrovert, introvert will either a positive will or a negative will. Intellect, it's a good intellect or a bad. Most of time the child goes into bad intellect. But you have to understand why this intellect has been compromised. Okay. Then the moral, good or bad. So good moral goes into autoimmune process, bad moral goes into necrotic process. The attachment, most of children having a certain attachment to certain people, person, place or anything. And the sensitivity, very important aspect of sensitivity. It is a SORA. But once you find a genetic mutation into the child, You have to just think that what was the pathology child is perceiving and what was the mother state. Combine both and prescribe. No need to take this. But once the SORA is there, development has started, then you have to go for the GCS. Are you getting me? This is a very clear cut idea. Now, this is the part which we call as history taking. Clear? History taking? Any questions up till now? So now, what to be cured in this type of cases and how to approach? If we have a Down syndrome cases, what to be cured and how to approach? Okay? So we will go into the journey, how to approach. So most of time, homeopathy tells us the law of nature. The law of nature is similia similibus murator, and this is to understand the human being, development of the human being. Okay? We are treating humans. So, simple example, if I will be an engineer of the car, so I need to know what part is used for the car mechanics. If anything happen into the car, I need to understand this is the cause behind the process. Okay, so same way if I need to repair the human being, what is that? I need to understand the development of the human being. If I cannot understand what was the developmental process, then I cannot treat the process. So same thing is we have to understand the human being. How we understand human being? We have to understand human being by the means of three processes. The development process start with the following order. The first is the anatomical development, second is the physiological development, and the third is the special function development. This is process called as embryogenesis. Okay, so embryogenesis and the theory of Vedanta, I should combine both for the easy understanding. So Vedanta theory tells us that this is a development following in the 5 koshas. Human being is made up of the 5 koshas. The 5 koshas is like that: Annamaya koshas, Pranamaya koshas, Manamaya koshas, Jnanamaya koshas, and Anandamaya koshas. Let me explain you. This is the outer sheath is called as food sheath or Annamaya kosha. The inner sheath is vital air sheath, the Pranamaya kosha. Then the mental sheath is Manamaya kosha. Intellectual sheath is Jnanamaya, and the core is this sheath, or it is called as Anandamaya kosha. So everything starts from the periphery to center. Okay, and in the reversal, disease from center to periphery. Are you getting me? Very important. So anatomy starts with the multiplication from the day 1. The foods start multiplying from the day 1. This is the anatomy. So anatomy is made up of protein, carbohydrate, vitamin, sodium, potassium, all the ingredients. So it is based on the energy. So this energy is the food sheet. Many methods start multiplying, give rise to the organ part that is going to be useful for the survival of the future individual. See, all the human being having a one cascade. Cascade means the frame structure. That means 2 eyes, 2 ears, 1 nose, 1 mouth, 2 upper limb, 2 lower limb. This cascade is everywhere in the human being. But if certain genetic mutations happen, that will stop or that will accelerate, and it will give rise to the developmental process. Okay. So the first is the form is the brain. So brain and nervous system is the oldest one. So old brain first, and it controls the first center of the respiration and circulation. So everything starts with the old brain. Then what happens? Those things are important when the treating cases of the mental retardation. Why this is important? If the child is coming to you with certain anatomical defect, you need to understand this will happen in the anatomical process. That means the first 3 months of the development. Okay? If the child is developed normally means the anatomy is everything is fine, but the physiological function has not developed, then you need to probe the cause in the later month of the pregnancy. Okay, so certain part is missing. For example, corpus callosum, agenesis. So you need to ask about in the first 3 months what was the balancing issue between the families. Why don't we need to communicate with the right and left hemisphere? Because corpus callosum is the communication. So something happening into the mother's mind. I'm going little fast because we have a short of time. Okay, we need to probe there and what was the cause. So I'm giving you just a few. Sometimes the cases of the, you can find that the cases of the twins, one twins is absolutely normal and one twins develop mental retardations or CP or everything. So say for example, if I have a wood, I will give a stroke to the wood, wood will maybe little bit injured. But if I have a glass and I will stroke on the glass, glass can break. So depending upon the sensitivity and susceptibility of the person, they can develop. So child is also susceptible, then and then they develop this disease. Keep in mind. Okay? First 3 months, in the 3 weeks of conception, so we have first the heart and primary circulatory system has formed. So if any problem in the mother's, any problem in the child like the ASD, PSD or the structural disorders, you need to ask about the first 3 weeks. Circulatory system has some problem. Okay? So material body gives rise to the food sheath. It is called Annamaya sheath and it gives rise to the material. So in material we have these organs. So what was the 5 organ of perception and 5 organ of action? So 5 organ of perception is our senses: eye, ear, nose, tongue and skin. This is the anatomy has developed. Previously the anatomy is needed. If we don't have an eye, do we see? No. If we don't have an ear, can we hear? No. If we don't have a nose, can we smell? No. So first anatomy has developed. So this is a 5 organ of perception and the 5 organ of action: hands, legs, voice box, anus and the sexual organ. Okay. After the anatomical structure has been formed in 3 months, then if the structure is ready, then there is a physiology. Say for example, if I have to construct the building. So in the building, I have to make a building. After building making, all is ready. Wall and column and pillars and everything is ready. Then we have to make an interior. Before that we can make an interior? No. That is what the physiology has started. So after the first anatomical development, the physiology has started and it is also in the mathematical order. Okay. So in order to survive, we need basic air, food and water, and this is what, if something is missing from this, the physiology has hampered. Okay. And this lead to changes in the patient in the form of disease, and that is presenting to you. Are you getting me? So you have to ask about the need of the patient. What was the basic need compromised during the pregnancy? Either a mother is missing love, either a child is missing love. So for example, what Kent is providing the magnesium was, I have seen lot of illicit pregnant child who have born from the clandestine relationship leading to a flat occiput, and this is a child is called as magnesium child, because this is something that they are orphanage, they having the feeling of 4 seconds. Okay, so this is what the love is compromised. The physiology. So in the physiology, if we have a 5 senses organ, then what was the developing? The 5 reflexes and senses is developing the 5th and 6th month. So we have the story that the Krishna told story to the Subhadra for the battle in the 7 chakras. So Abhimanyu knew before he was born. So that was, he was hearing into the womb. Okay, so senses has developed. The first senses what developed is hearing. The second senses was the vision. Then all the senses were developed. The first senses was developed, and the physiology of respiration was started, and the physiology of eating, digestion, distribution, assimilation was started, and the physiology of converting food into ATP was started. So this was the physiology. So for physiological function, we have the 5 ingestion mode cells, digestion mode cells, metabolism of energy, distribution of the food and energy, and excretion of the waste. For that we have all the organs. Okay. For ingestion we have a mouth. So we can ingest visual morsel through the ear, we can ingest hearing morsel through the hearing, we can ingest the food morsel through the mouth. So there is the ingestion. Okay. Then digestion, the processing. Then metabolism and converting into energy, that is the liver. And the distribution of the food and air into blood circulation. And finally the excretion through the alimentary systems, like the kidneys, skins and everything. Okay. So physiological functions gives rise to this pranamaya. So then this gives rise to air, vital air. So vital air gives rise to livingness. Okay, very important. And this, if we don't have energy, we cannot survive. Okay, law of energy, energy cannot be created, energy cannot be destroyed. You can convert from this. So this is what the very important aspect of vital energy is taken care by the energy. Before that, what was the thing? So first, we have to understand anatomically we have food sheath, physiologically we have a air sheath. The pranamaya kosha. So pranamaya kosha composed of the 5 faculties of functioning. You cannot see that, but you can feel that. That is called prana, faculty of ingestion, apana, the faculty of excretion, samana, the faculty of digestion, vyana, the distributions of already digested, and udana is absorption. So this is what vital air sheath. In ingestions, we have a morsel food, mouth, it gives rise to a taste. Air from the nose gives rise to a smell. Hearing from the ear gives rise to hearing. And the touch from the skin gives rise to a touch sensation. And the morsel of seeing from the eye. So sometimes you can find out the child does not like touch of the any persons. Or child wanting to touch everything, touch impaired. So that means this faculty has been either exaggerated or deprived. Are you getting me? You have to understand. So in the excretions, stool, urine, perspiration, sperm and thoughts and actions. After that, the third sheath was the intellectual sheath. So intellectual functions as thinking, reflecting, reasoning, discriminating, judging, and it controls about 2 sheaths. So vital air sheath and the food sheath is controlled by the intellect. Okay. So in the case taking, intellect is more important than the emotions. Intellect is more important than the senses. Intellect is more important than the physicals. Are you getting me? So intellect has the 3 points. The gross thinkers and analyzers, subtle is the spiritual, and the third one is the project himself as the intellectual. I am not intellectual, but I can show you I am an intellectual. This is psychology. It is adaptations. Okay, but basically these 2, gross thinkers, analyzers, and spirituals. And the last sheath is our soul, which we call as a soul, deepest sheath, and it considered as a stem cell of the body. So this soul comes to this earth for a certain purpose. They have to learn something, and they have some ancestral memory which can guide them that you have to suffer this. So sometimes you have to go to the stem cell similar. It is a higher version for you people because we also learning these things. It's called as Mahakaran course. Okay? But I will stop here for this because it is difficult to understand. So to approach the case, this chart is very important. Take a snap of this chart in each and every cases. You have to understand if the anatomical development is problematic, then you have to ask about first 4 months of the patient during pregnancy. If this is the vitality enter into the body, viability enter into the body, and in later months the physiology has affected. So if physiology affected, ask in the 6 to 9 months of the pregnancy history during the mother state. Now, this is what I have given you the brief idea of approaching the case and approaching the case taking. Now we have to understand. See, first slide was I do not see what mind does not know. So I said in the first slide that we have to understand the disease and the mind of the pathology and the mind of the pathology. So I will give you 2 examples of the mind of the pathology. What is the mind of the pathology? See, each and every cell has an intellect, and that cell is representing you as one human entity. One single cell is representing a human entity. So this is giving rise to a certain mental faculties. Every cell has a brain. It is called as organ brain, and they have, if they have some input, they are reacting to certain pattern only. Okay, and this reaction is called as the mind of pathology. So pathology develops when certain emotions or trauma is given to the cell. So this is what the correlation is. Mental cause is the mind of the pathology. Are you getting me? Clear? Any question up till now? So what is mind of pathology? This term was coined by the Dr. PRAFFUL VIJAYAKAR, and he says that the genetic and epigenetic factor responsible for how organism react with its pathology is equal to with its defense. So every cell has a defense, and we know the defense are of 3 types: Zora, psychosis, and syphilis. It means the physiologically Zora, structurally or morphologically constructive it is a psychosis, and structurally morphologically destructive is syphilis. So this is what the self-defense mechanism. So every factor is giving rise to certain pathology, and that pathology is the mind of pathology. What aphorism number 189 tells us? Yet very little reflection will suffice to convince us that no external malady can arise, persist, or even grow worse without an internal cause, without the cooperation of the whole organism, which must consequently be in the disease state. That means what? This aphorism tells us, without any cause, cell cannot react. Okay? So if cell has a pathology, you must have to find out the cause. What was the cause behind this pathology? Are you getting me? And without cooperation of the whole body, we cannot develop. Okay? If I am healthy, I cannot develop. But if I am diseased by certain trauma and my need is compromised, I can adapt initially. And this adaptation has failed, cell injury continue, then I have to change my gear from SORA to psychosis and developing the pathology. Are you getting me? Easy? So aphorism number 189 tells us, without the consent of the whole of the rest of the health and without the participation of the rest of the whole. This is the same thing. So what as example as given is, no eruption of the leaf, no whitlow can occur without the previous simultaneous internal ill health. Even small eruption cannot come without the cause. Clear? So what Vijayakar sir has said? The mind, thoughts and the mental emotional event play a core role in the development of the disease, and that most pathology arises due to emotional conflict. In footnote number 9 it is written that the most dreaded disease are developed due to the imagination, and it can be cured by the same means. So imagination is happening at the mental faculty, plays a role in development of the disease. Clear? So it is also same thing is written in the chronic disease in the different version, that an unhappy marriage can give rise to certain things, but knowing conscience means the guilt. Can give rise to certain that annual death of only son causes an incurable suppurative lungs or breast cancer in the tender mother who is already chronically ill. So if the child is dead, she develops breast cancer. Are you connecting these things? Got? Now what Hammer told is that nest worry conflict. So this is what something is happening. It was written before Hammer. So HAHNEMANN was far ahead of everyone. Okay? So prune love causes melancholy and the soulful virgin who is already historically hysterical. So all the causes has developed because of certain trauma. So the type of the emotional conflict determines the localization of the disease and has a connection to the person's sensitivity. This is very important aspect. Emotional trauma, localization of the part, and the person's sensitivity. If person is not sensitive enough, he cannot develop. Are you getting me? Easy? So because the disease are the organism of defense mechanism. So any disease developed is the defense mechanism of the human being. So in the mind of pathology, you have to remember this chart. So once you have to understand which side of the body is affected, so according to that you have to ask a certain question to the mother or relatives. So if the right side is affected, so complaint happening in the right side of the body, very often indicate the problem with the partner. It is a life partner. So it can be husband, it can be wife, it can be boyfriend, girlfriend, or some business affairs, or some colleagues, friends, enemy, neighbors or relatives. So epigenetic factors. Okay? And another is if the left side of the body is affected, it indicates there is a problem with your mother and child. Sometimes the father. Why father? Because the person feels that the father is my child. Because she is taking care of the father as her child. So that's why father also there. So parents, children, siblings and people who have parental and brotherly or sisterly feeling for. So these are the causative factors you have to ask into history. Are you getting me? Right side is affected, problem with the partner. Left side is affected, problem with the mother and child and the emotional attachment. So this is the same slide but in a written form. So with genuine left-handed, if the person is the things, the slide is given right-handed person. For right-handedness, you have to ask about the clapping test. So dominant hand is the handedness. Person says, I am writing with the right hand, but clapping like this, it is the left hand. Clapping like this, this is also left hand. Because he is adapted their process. Okay? If the genuine left-handed, if the person is left-handed, the previous slide is vice versa. Clear? So let's have some example of the mind of the pathology. I will guide you that how to probe. So if we have a autism child, what is the meaning of autism? Communication cut off. I don't want to communicate with anyone. So this is the meaning of the communication cut off. So something the patient has seen or experienced, or something that has put him or her off guard, leading to I don't want to be in this world, in this society, in this family. That leading to autism. Clear? Okay. So mostly hurt by the parents' behavior. So if the autism develop before birth, means the mom, then you have to ask about the mother. And if autism develop after birth, then you have to ask about child is sensitive to what? So child is sensitive to the behavior of the parents. So if the quarreling parents are there, then also child may develop that this world is hostile and I cannot communicate with anybody. I don't want to survive in this world, so I have to go or withdraw myself into ours. So that leads to the process. Issue of, see, we have a lot of research in the vaccinations, that there is a vaccination just trigger the autism, but unless and until what our master says that if the child is predisposed to certain mental trauma, then and then vaccination can aggravate, otherwise not. Okay? So vaccination is not the cause, it is just a correlation between the vaccination and autism, the percentage is so high. Okay, but that child was so sensitive before that, then and then he developed this. Many autistic children having a cesarean sections child. So right now we have a lot of IVF children, and in IVF children we can find out that this is a cesarean. So this cesarean section gives rise to syphilitic birth, and in the process it can making towards child with the syphilitic instructions. So case, I will share you one case of sir, that it was that why does child develop autism? So child came to the surgery after parent got divorced. The boy was very quiet and normal until the age of 2.5 years. So this is what after birth was development. The child was absolutely normal until 2.5 years. Then suddenly stopped responding to other people. So this was the development. So sir asked what had happened. So at that time parent was argument and were getting worse and worse, but they took care of no argument in front of the child. See, both parents are getting divorced, so they are arguing in between. But they took care that in front of child we have to become so calm and cool. Okay. So in normal relationship, one night, one incident was there. One night it was happened that there was a big fight, and the child woke up and startled and immediately switched to using, and mother father saw that child is woke up. So they immediately switched to the kind word from the quarrelings. So the boy was just stare them and look at them, and the boy was confused that are they are fighting or are they are loving each other? I cannot understand. Okay? So that was a confused state, giving rise to intro. That shock create confusion, and that was the reaction giving rise to autism. So on the basis of this, sir has to, so I am not wasting a time by asking questions, but sir has to, that confusion cannot tell what is real and what is unreal. The child cannot understand what is reality and what is unreality. Is mother father is quarreling or is mother father is loving each other? So that was a creating confusion. In that the lab CPU was there. So sir said that there is a lab CPU, it is composed of the calcium. So sir prescribed calcarea phos to the child, and that child was recovered beautifully. So this was one of the case. Another case, this is what mind of pathology. Are you getting me? What was the mind of pathology? Why autism is developed? Because of this reason. This is one case. You have to ask what happened into the child, what happened into the mother. From that you have to correlate, and that is the development. Okay. So another case, that is the case of the opisthotonus. So opisthotonus was like this. Okay. So very important. So in the opisthotonus, is lying on table, look like a scorpion. So you have seen the scorpion. The fang of the scorpion is like this, and so this is opisthotonus. Okay. So on the basis of that, sir has said that his father, sir has asked certain question. Does child is very angry or revengeful? And the father says he is very angry and revengeful. So sir says, I have not used in my practice the remedy scorpion, but scorpion is one of the angry and irritable remedy having opisthotonus. Okay, so this is called mind of pathology. The remedy prescribed was scorpion. Bent backward. What is the meaning of bent backward? See, opisthotonus is one of the process, but if the child is, you have some CP child and that CP child was like this, always bent backward. So what is the meaning of bent backward? So bent backward means I cannot tolerate any authority. I am a defined kind of personality, genetically. I am a strong-willed and I am a challenging you. So that is never give up constitution. This is the mind of pathology. If the child is look like this, bend forward. Okay, so bend forward means what? I am submissive to you. I am servile to you. I have no will. So this is what the another mind of pathology. Why every posture is adapted by the child is based on mother perception goes to the child genetic system. Okay, so every disposition is based on the perception. So bend forward means person is submissive, has no will and no ego. Okay, or they are generally give up kind of personality. Few more examples. If we have an accumulative pathology, something which is accumulated, so that means accumulation means what? If there is an uncertainty in future, I need to accumulate more so I can survive properly. Okay, so this is uncertainty. So for example, ascites. Ascites means what? They need a protection in the abdomen, especially of the abdomen, more of the liver. So what is the liver represent? Liver represent a powerhouse, a factory, giving rise to a nutrition, giving rise to the energy. And if I do not have energy, what I suffer? I feel starvation. Eye. So pointing upwards. This pointing upward eyes is represent that I have some ego and arrogance. Okay. Loss of color vision. If you have a child, the eye develop normally, but child cannot perceive the color. So that means what? The child is not having any interest into this colorful world. So it is indifferent, no interest. If the child having glaucoma, there is an increased pressure in the eye. What is the increased pressure? To protect the retinal detachment. Okay? And the cloudy vision. Cloudy vision means what? I am so confused and no clarity at all. That is giving rise to a cloudy vision. If the protein has been changed, it's like elastin high. So when the elastin high, there is a cramping and contraction is happen. So most of time in CP child, they like this stiff. Okay, so this is mostly because of suppressed anger or boxer. What is the boxer attitude? If the opponent is giving me a, so I will be in a strength to fight. So this is what the contraction. This contraction giving rise to a fear. So whenever you find a spastic CP, you need to ask about the suppressed anger or the fear related to certain situation in the mother's life. Elastin low. If the elastin low, there is a slackness, looseness or weakness of the muscle, or either a hemorrhoids or a prolapse. So most of time this happen because of shock, this happen because of the fright, this happen because of the grief, this happen because of the worries. Are you getting me? So if someone has given a shock or surprise, I was shocked, so I become so relaxed. You have seen fight, flight and freeze response. So when there is a fright, highest amount of the fright, the freeze response gives rise to a paralysis or shock. I cannot move. It is called dead play. Dead play means paralyze themselves to save themselves from the predators. Okay? Elastic legs. If the fibrin is high, it represents the hardening, contractions, occurring arthrosclerosis or induration or stenosis. So hardness can be break. Okay. So most of time their attitude becomes very obstinate, hard, unyielding, arrogant or pedantic or sometimes hard-hearted. Okay, hard-hearted, unemotional people. Fibrin low. So fibrin low giving rise to dilatations, brittleness, softness, weak hand, soft teeth. So most of time you have seen the soft child. This is fibrin less. Their cheek is very soft and flabby. Their skin is very soft and flabby. This is elastic fibrin low. This gives rise to these children are very mild and yielding, diligent kind of personality. They can obey anyone. They are servile. This is fibrin low. Initially I said liver is the center of metabolism, so liver associated with the undigestible anger, fear of starvation or the family conflict. The heart. If the child having some heart disorders, you have to understand what was the heart represent in the mind of pathology. Heart gives giving of love in general. So it gives blood to the whole body. So mother supplies the child with the food. So if love remains unfulfilled, body reacts. This heart is mother, periphery is child. So heart is giving nutrition to everyone. So if the mother is not getting love, the child also not getting love. So unfulfilled. So body reacts. So if his heart is not properly developed, the trauma must be occurring in the first 2 months of the pregnancy, anatomical structure. Okay? Arrhythmia, heart was developed, but functioning is disturbed. So consequence of the anguish, most of time the anguish produce high adrenaline rush, and that adrenaline rush giving rise to the uncontrolled aortic node or SA node stimulation, giving rise to the fluttering, giving rise to arrhythmia of an asystole and the supraventricular and supraarterial tachycardia. So this is arrhythmia. Okay? And sometimes the anguish can be caused by the forming of the serotonin. It also stimulates the same acetylcholine and lead to the cardiac arrhythmia. So adrenaline, serotonin, both are giving rise to the hyperfunctioning of the heart. So most of time when in the ICU, the heart was ceased to stop. What was the injection was given? Adrenaline. This stimulates the heart actions. Okay? Heart attack. What happened heart attack? Unhappy in the marriage. Bone. So what is the mind of pathology behind the bone? Bone is equivalent to the structure. If building lacks structure, value decreases, the bone problem starts. So value means what? Our high esteem, our appreciation, our humiliation, our pride, our ego, our prestige has been cut off. Our prestige has been humiliated. So that can give rise to the problem in the bones. And also sometimes this esteem has been cut off to such an extent that they loses their identity. Then also the bone has been. So bone identity was, what is that bone identity? I need to be a strong. And if identity has been lost, what happens? Bone becomes so fragile, it can break easily. The case is osteogenesis imperfecta. If the person having a motor neuron disease, that means what? A feeling of being trapped. So now is being entrapped by certain. So feeling of trap being in certain situation, I cannot move this way or this way. I have everything, but I cannot. So helplessness or trap feeling. These are the reasons. The again, helplessness goes into higher version is antagonism with the self. I have everything, but I cannot move. This is autoimmune. This is headache. Newer addition. Corner of the mouth represent the connections and relationships. So most of time you will find out that there is a cracks in the corner of the mouth. That means the relations with the side. If it is a left-sided, it can be a mother. If it is a right-sided, it can be a fathers or it can be a partners. So some connection has been missing. So cracking means the relation was broken. Sexual identity. So I will give you one example of the case. A child born with a vagina without ovaries and testicles. Okay? This is called as ambiguous genitalia. Without the penis, I asked, so sir asked the mother directly, what have you got against the men? The question was, see, child born with a vagina, no ovary, no testis, no penis. So sir directly asked the question, why are you against some men? So mother has told that she was beginning to cry and she says that I had always had endured bad things from the men in my family and ever since childhood. So she was so much so dominated by the male. And after I got married, the same thing happened in the husband and in the same family. So she didn't want to marry and but divorce. So she didn't want to give birth to this boy. Okay. genetically he is a boy, but he developed vagina. So what was the pathology? Child is confused. Do I male or female? I am confused. So sexual identity was confusion. And what was the mother perception? Aversion to men's opposite sex. Okay, she was a female. She is opposing the male. This is the mind of pathology. So in this whole cases of camp, we have to understand this child. If life is a problem, we have to understand the that related causes. Okay? If life is okay, their existence is okay, but their existence is the human existence or animal existence, you have to find out the hierarchy. So identity was not developed as a male, as a female, or as a human. So first step we have to understand the animal identity, you have to convert into human. Then after human, we have to convert into male or female. So sexual identity. Then the central axis, both side has been developed properly or not. Right side is improper, left side is proper. So you have to understand this axis. Okay? Then the body parts develop in the birth. Then anatomy has to be taken into care. Anatomy is developing proper or some problem in the anatomy. So if problem in the anatomy, ask in the 4th month of the pregnancy. If anatomy is good, then the vital force, the vitality is started. Then the senses has been started. Ask about the senses. So most of the time we have cases like deaf and dumb in our camp. So what was the reason in the 6, 7, 9 month? What you do want to hear? Because I don't want to hear something. So I don't need ear. And that is the reason the child born with the hearing defect. Okay? So you ask about what was the sensitivity of the mother and what was the perception sent to the child that you don't need to hear this. Because this world is so hostile. Hearing is not important for your survival. So senses. And then birth. After birth you have to understand the physiology of respirations, then cardiac, and then the whole development. So developmental. So after that developmental has been set. This is the chronology. If you find the problem here and you have some rubric here, take it because this is the hierarchy, very important. If you find problem central axis and you have a problem with the right axis, you have to take into consideration. It is very important to treat the case. So that's all for the today's case taking. Thank you so much for the wonderful session. I am requesting all of you doctors to give your 100% to this child for their beneficials. In the end, we make this child from hopeless to hopeful. We make this child from independent to independent state. And with the blessings of our Guru, Dr. PRAFFUL VIJAYAKAR sir, we are making this good for all the suffering humanity. Thank you so much for wonderful session. Thank you.